And joining us live right now is Anand Arya, environmentalist, watching this situation very closely. Thank you, sir, so much for your time. I'm wondering, why isn't the government wanting to be bound by what the WHO says, since India is very much a member state, and when these guidelines were set, India was party to these discussions. Now India says, listen, we have our own standards. What do you make of it, sir? How do you respond to what the government has now said?
You see, the government will find some excuse or the other for, explaining its complete inability to control, or rather, I should say, for its complete inaction in controlling the air quality in NCR and also in the other parts of the country. Now, very surprising. I've been listening to your broadcast and I've been seeing some of the news on the internet. Where is the new standard? What is that new standard? What is the AQI standard by which the minister is saying that we have got our own and 130 cities? Of course, there are more than 130 cities with a much better air quality, and they are all located. Majority of them are either in the hills or they are on the coast, where the air takes care of it.
That's right.
The whole thing, or the rain takes care of it. But coming down, can CAQM, which was launched with such a fanfare, can exactly tell me what is their target of AQI for Delhi in 2026, 27, 28, or 2030? It is
Anand
such
Arya,
a
actually,
pathetic.
the government's own standards, which is the NAAQS, is actually way lower than what the WHO says when what your PM 2.5 and your PM 10 levels should be. It's actually about 6 to 8 times higher, and that's the reason why so many Indian cities are failing that benchmark and are being cited to be the worst polluted cities. The government obviously is wanting to avoid this embarrassment and say, listen, we have our own guidelines, we have our own geographical
Okay, then
location.
let them
Then
let
why
them
be a
raise
part
it.
of the World Health Organization to begin with?
Yeah. And then raise this saying that the AQI in Delhi will be or PM 2.5 or PM 10 or and S, whatever they want do it, will be in the region of 400, and then no city will ever be, polluted at all. I mean, what is this nonsense? Because CAQM does not even have their, document of policy on their website. I had to make efforts to get a copy of that. And
Right.
then why is it not being published in the newspapers that we will clean the air of Delhi or NCR or any particular city by a certain date? What is that date? I want to know. And what are they going to do in year one, year two, year three, or month one, month two, month three? I have written to the Supreme Court, which is monitoring and says, the Chief Justice says that we will be monitoring it twice a month. Now, where is the accountability? Where is the punishment for the derelict official? I mean, so terrible actually that you can't even go out for a walk. You can't sit out on your terrace. And I have given these suggestions that, in fact, I have shared with one of the persons who has the ear of the Chief Justice of India, especially on this air issue, a very senior advocate, that this is the format in which I want CAQM to publish that this is what we are going to do in the next 12
Is
months.
this a government in denial then? What do you
Yes,
think about what they've said?
exactly. Yes, the government is in denial because they really haven't done it. And from your own platform, I think in the last 10 or 12 years, many times I have spoken on this issue.
You know, my
That,
question is, when you follow WHO on every other guideline, including on COVID,
yeah.
on infectious diseases, on non-communicable diseases, then what stops you from following the WHO on these guidelines, which of course is for every other member state, not just for India? So if any other country like China have bad air, the WHO is going to point that out and say this doesn't mean the standards. It's not like they're singling us out or picking on us, isn't it?
No, it's not just a question of following either a WHO format, laid down standards or my own standards. What I'm saying is that we have an X target for the quality of the air. Okay. Now the question is, what are we going to do it? Are we delivering it? I don't care what standard they follow. It doesn't matter. We are members of the WHO. And it's every time, as you said very correctly, we quote WHO, WHO does this, WHO says this about India, about the vaccine, and this and that, and everything. So even if we have our own standards, whether they are lower or higher than that of WHO, I want accountability from the government that these are our targets. By this time, we will give you this quality of air. And how we will do it. Step one, step two, step three. I've written it down. Now look at it. Every time, I mean, the people like us, the middle class people, they get blamed. Okay, your vehicle is polluting. Now, have they done a very, very simple thing of staggered working hours, a
Okay,
plan
there are
which
multiple solutions, but you have to be ready to look at those solutions, essentially, isn't it? The big question is when you start to acknowledge that there is a problem, that really is the beginning of the process of finding solutions, isn't it, Anandarya? But it
yeah,
seems like now that the government is indicating that, listen, the standards are very different from our reality, and that's the reason why we need to stick rather to what our benchmark is. It isn't an argument that really is cutting eyes with environmentalists,
no, I don't
health
think that.
experts.
No, no, no. I can't
Yes,
agree with you on this
yes,
issue. The question
okay,
is very simple: fix a particular target, fix a
okay.
particular date, let the public know on a regular basis through
Okay,
the
that
public
information should continue
that
is what you're saying. I'm afraid we're really running out of time here. I'm going to thank you, Anandarya, for joining in with your views on that.